Hey guys, this is Dr. Kristin. I'm here with Dr. Joelle at Trinity Chiropractic. We asked all of you to write down some questions this week about just things that you're wondering, things that we can answer for you. And one of the most common questions that we got was what to use instead of sugar. So if you're looking for a sugar replacement, what can you use? So one of the most important things when you're looking for a sugar replacement is to read the ingredients. So things like Swerve and stevia and the raw are just two examples. But if you flip over the ingredients, you see things like erythritol and dextrose. So erythritol or xylitol is a sugar alcohol which can actually cause gas and bloating. And then dextrose is actually just a sugar in general. So what can you use? What we recommend would be stevia extract in the liquid form, so it's a little dropper. So that's what would be the best one for you guys to use.
Yeah, so obviously you avoid everything that finishes in OSE, like dextrose or sucrose or any type. That just means that it's sugar. So even in this packet, for example, the stevia one, this says it's stevia in the raw, but the first ingredients is dextrose, so it's highly deceiving. So you have to really watch and read the ingredients. So using the dropper of stevia is by far the best, especially if you have disease process, if you're wanting to lose weight quickly, if you have cancer or heart disease or anything like that. You don't want to do anything that increases your insulin levels, and stevia will not increase insulin levels. That's why it's so good. If you don't have any disease process at all, you can also use raw local honey. And I say raw, which means unpasteurized local honey, which you can get at any farmer's market here or any health food store locally here in Naples. And I strongly suggest using that. Or if you're baking, you can sweeten things with bananas or even applesauce, which still gives it a sweetness, but it's not like sugars like this that cause insulin spikes and affects your whole hormonal system. So hopefully that answers your question, and we look forward to answering future questions.